we will take that on. We're going to turn to a related issue, which is the research being done at SDSN on the differential reach of the SDGs to different ethnic and racial communities. And I'm delighted to, again, I mentioned yesterday, and many of you were in her breakout session, to meet with Alainna Lynch, who is the Senior Research Manager at SDSN USA, working on the SDGs in the United States. And Alainna has been producing wonderful reports with Caroline and colleagues on how to have a truly inclusive SDG agenda for the United States, and how big the gaps are, the racial gaps and the ethnic gaps are in the United States right now. Alainna worked at ODI, Overseas Development Institute, before SDSN, and she is a graduate at Oxford in evidence-based social interventions, and at the University of Chicago in sociology. So Alainna, we're looking forward to your leading us on the work that you are doing on the differential impacts of the SDGs.
Yeah, thank you, Jeff. I'm going to share my screen.
Great.
Has that worked? Okay, great. So thank you. I'm going to be talking about tracking SDG progress in the United States. Today, I'm going to be joined by Sharon Paculor, who is the Senior Manager of Special Projects for the Director at the Center for Sustainable Development, overseeing projects including the World Happiness Report, the Global Happiness Council, Science and Ethics for Happiness, and Ethics in Action program with the Vatican. For over 12 years, Sharon worked in the architecture, engineering, and real estate industry as a marketing and business development professional, focusing on green infrastructure and sustainable workplace environments. She holds a certificate in sustainable water management from Columbia University. I'm also going to be joined by Dr. Helen Bond, who is an associate professor of curriculum and instruction in the School of Education at Howard University in Washington, DC. She is also a Fulbright Nehru Scholar to India, and of course, a co-chair to SDSN USA. Helen has served as a research fellow with the George Eckert Institute for International Textbook Research in Germany, where she is conducting research on the historical memory of the US Civil Rights Movement in school textbooks around the world. With a PhD in human development, she teaches courses on education and human development, teacher education, and culturally relevant pedagogy. So thank you both for joining me as well. Today, I'll tell you a little bit about the work we've done so far to answer the question, what will it take to achieve the SDGs in the US, and how we plan to extend this work in the coming years. Then I'll turn it over to Sharon to go into a bit more detail about the work we plan to do in the coming year around well-being, and then to Dr. Bond, who will expand more on plans for equity and justice in the network. We hope you'll be listening for places where we might collaborate or deepen or expand this work based on the work that you or your institution is doing. So first, I just wanted to give a quick overview. SDSN produces a variety of reports.
Your slides aren't advancing on my screen, at least.
Oh, maybe I'm going to stop and try it real quickly. Has that been effective? Okay, thank you.
Try going forward one and back just to make, okay, perfect.
Okay, great, thanks. Now I've gone too far. So this is the overview of the reports that SDSN does. There are the global editions, regional editions, like a report on the Africa countries, and also sub-national editions, which is a little bit of what I'll be talking about today. As Jeff mentioned yesterday, this is the US performance overall from our Global Sustainable Development Report. The US is ranked 31st and has a score of 76 out of 100. So we interpret that to mean that we're about 3/4 of the way to achieving the SDGs overall. If we drill down into the state level, we see that the picture gets a little bit darker. There's quite a bit of states that are red, and we interpret red to mean that there's significant work to be done. and there are no states that are green, which would mean that on track to achieving the SDGs. At the city level, there's similar results. Here's a map showing the 100 largest MSAs. And here's the dashboard, which shows on the left, the 100 largest MSAs, and across the top, the 15 of the 17 SDGs that we measure. And you can see there's a smattering of green in certain places, but overall, still quite a bit of work to do. Here is just an illustration of what the benefit of having these different nested indices allows us to do. We can look at US averages and then drill down a little bit further. Here's an example from California, and we're looking at youth that are not in school or in employment. And we can see that the results vary dramatically if we look at different cities within California. Another project that we do is America's Goals for 2030. This is a project that we do with Future Now. The America's Goals are a localized version of the SDGs, and Future Now works directly with state legislatures on what policies they can put in place to help achieve America's goals by 2030. They also have a model policy library, which uses evidence-based research to develop the strongest policies or most effective policies to achieve these America's goals. I wanted to highlight that for you all because I feel the brain trust of the USA Network might be really interested in maybe moving your own research through this connection. So this is the work that we've done so far. Coming up, we'll be releasing an update of the state index in this fall in advance of what we hope will be a 2021 VNR. So if you have ideas on how this work might support these efforts, please do be in touch. We're also going to be expanding SDG analysis at the county level and exploring how we can make use of GIS to communicate progress and understanding. We're going to be expanding the work that we do on racial justice and equity more broadly, expanding on the work we did here. Dr. Bond is going to discuss this in more detail in just a few minutes, but this is the report we did with the National Centers for Faith-Based Institutions and Howard University. Never More Urgent, a preliminary review of how the US is leaving Black, Hispanic, and Indigenous people behind. We think this was one of the first known attempts to use the frame of the SDGs to analyze systemic racism in the US, and we hope to expand and deepen this work in the coming year. This work is based upon an index that we created that measures how differently the US states deliver the SDGs to different racial communities. And look to this spring, we'll be sharing that. And here is just a quick preview of those results. And here we're looking at US life expectancy overall. And then we just picked one state, in this case, Minnesota, which actually has a better life expectancy than the US average. But if we break that down, you see that the Indigenous and Black communities have a life expectancy that's much lower than both the Minnesota average and of other communities in that state. So this is really important as we think about the Leave No One Behind agenda. And it's imperative that we put communities that have been served least in development first as we start to deliver the SDGs. So the last thing that I wanted to just preview is that we're going to be exploring the connection between the SDG process and well-being in the US, which of course is very much connected to this work you see here. And now I'm going to turn it over to Sharon to speak more in depth on that.
Thank you, Alainna. Can everyone hear me? I didn't do a sound check. Okay, great. So I'm Sharon. I've actually been working on the World Happiness Report for over the past almost +6 years. And I'll just give you a very short overview. You can go to the next slide, Alainna. If no one's familiar with the World Happiness Report, we do measure happiness on a global, worldwide level. We take countries from about 156 countries. We use Gallup World Poll and then measure 6 indicators of, what consists of well-being and happiness. And they are freedom, generosity, health, social support, income, and trustworthy governance. We are actually releasing the new report. And in exactly 1 month from now, we hope you will be able to join us and read the new report. You can move on, Alainna, please. So interesting when we look at well-being in the United States compared to other countries, the last 5 years, 2017 to 2020, the rank of the United States has significantly gone down. I see, between 2019 and 2020, there was a little bit of a upward, but total trend over a 10-year decade period, the United States score in well-being has been dropping and has been definitely dropping in ranking. Just to give you a example, the top ranking countries, which is usually the Nordic countries, are Finland, Denmark, Switzerland, Iceland, and Norway. And if you look at the numbers, the top countries are being scored or scoring about 7 plus, whereas the United States has barely reached 7. You can go to the next slide, Alainna. So what does this mean? The Cantrell ladder, which is like a self-reporting, how do you feel on a scale of 1 to 10, 0 being the worst possible life and 10 being the best possible life. And so with that, marking as 7 means that we're thriving, or you're thriving, or the country's thriving. Anything below that, we're not thriving. And as I mentioned before, the United States hasn't even reached, 7.0. But, when we do a more drill down, and this is now looking at Gallup's daily poll of American well-being, the only group that's thriving are white non-Hispanic. And you can see that the other ethnicities and races are not thriving. And that's something of a concern that we should, bring up. And that's where well-being is important in measuring. Yeah, why is it important? Because measuring well-being helps us evaluate the impact of people's lives. So then this in turn helps us to tailor our public policies or our services to meet the people that we need to help in order for them to be thriving and have, well-being. In terms of well-being and the SDGs, Professor Sachs actually wrote, and Yanni-Manuel Deneve wrote a chapter last year in the 2020 report on there is a strong correlation between the achieving the SDGs and well-being. That was almost like an assumption before, but it was tested, and there is empirical data that they are very much correlated. So when think about policies for the US or any municipality or cities, well-being should be a part of it. Part of the goal of the World Happiness Report is to influence countries in their policies and putting well-being as a priority. And I hope that the US would do the same. So we are working on a kind of a new project where, like the World Happiness Report, we would like to also measure, the United States well-being or happiness in the United States specifically. So we're hoping to do that in the next year. And, if anyone would like to help us in this mission, it would be great. Thank you, everyone.
Thank you, Sharon. And now, Dr. Bond, if you'd like to lead us in this last portion.
Yes, thank you very much. I'd like to say thank you to our viewing and listening audience. I'd like to give a shout out to President Frederick and Provost Wootaw for their wonderful leadership at Howard University. I'm going to speak to you briefly about the work that we're going to be drilling down on at SDSN, racial justice and the SDGs, and a little bit more about the report. If we could go to the next slide, Alainna, the never more urgent. And so we have limited time, but I want to say up front that we will be drilling down even more in a breakout discussion that takes place at 2:30 with Claudia Roma Edelman. She has some wonderful data around the Hispanic Latino community that she would like to share. And so many of the slides that I'm going to go through It's going to be very brief, but we will drill down later. And we will also be talking about introducing and inviting you to join and work with us on a new working group around equity and justice. This is built on the framework that, I think we need to maybe communicate a little bit more. I've heard lots of people discuss about how the SDGs does not seem to be relevant to minority communities. And I want to talk a little bit about how we can make that more relevant as one of our platforms of our new working group. But the notion of leave no one behind is really the platform that drives, that give form and being and justice, I think, to the SDGs. If we could go to the next slide. Thank you so much, Alainna. Alainna has partly described the methodology. We'll go through that very quickly. We use 32 state level indicators, 35 national level indicators across 10 of the Sustainable Development Goals. Not because there's only 10 that really applicable to equity and justice. Indeed, they all are, the 17 goals. But we honed in on these mainly because of data and other methodological reasons. But we did find 5 main areas where the data revealed the biggest gaps between the Black, Hispanic, and Indigenous communities as compared to the white community as the comparison group. The 5 main areas were, and I think you could guess, and even though we highlighted 5, there are many more, but justice, food and housing insecurity, education, economic security, and health. I'd like to say that Dr. Clarence Hussein from Howard University contributed to this work, and so he shared on some, especially our criminal justice data. Thank you so much, Alainna. The next slide, please. Here are the included topics, the SDGs of primary concern that we used in our report. And I, at the last minute, changed the slides, and Alainna was so gracious to be able to get a couple new slides in. But I wanted to highlight the particular SDGs relevant to this work. We did a workshop a couple weeks ago. We've done several. And occasionally at the end of the workshop, we would get the question of, well, we talk about our equity and justice, the never more urgent, and someone would ask us, well, what does this have to do with the SDGs? So that is a critical question, and I think a critical focus as we move forward in our new working group. And with this, I wanted to highlight the topics of concern. Thank you. Next slide. We created a model when we did the never more urgent monograph, which I'm calling it. This epitomizes the 5 key areas where we found the biggest gaps, but we also situated it in the frame of COVID-19. How these, and I think this is really a particular strong piece of this, how these 5 areas create the disparities that we see in COVID-19 infections, deaths, now also in vaccine, not only hesitancy, but vaccine disparities. We'll go to the next slide here. In essence of time, apologize for the very quick overview. Criminal justice, oh my goodness, so much disparity here. Even though we highlight in the report, due to a size, just a few of the areas with the widest and the most persistent disparities, use of force. We see that in George Floyd and others, racial profiling, jury selecting, drug arrest, traffic stops, incarceration rates, and we highlighted the Indigenous communities. The requirement to use the U.S. justice system is really a challenge and a throwback when it refers to the rights of Indigenous sovereignty. If we could go to the next slide, thank you. Economic security. I was trying to select last night, looking over some of the data, and again was shocked at the race in child poverty in a nation that purports to be the richest nation on earth and a democracy. You have in Mississippi and New Mexico 52% of children living below twice the poverty line. In Louisiana and Arkansas, 50% of children living in poverty. Both Black and Hispanic, Black and Brown are more than 2 times likely to be in poverty than white children. Next slide, thank you. Food and housing security. We have a wonderful working group looking at food insecurity, and we connected it in this report with housing. Black people are 2 2.6 times more likely to be food insecure than white people. Hispanic people are twice as likely than white people to be food insecure. And a finding that we consistently found throughout our report, and that we talk quite a bit about in subsequent reports, the lack of critical data. So data on Indigenous people simply was not available, but this is not just a one-off. We consistently found this through our findings, the lack of consistent and collection of data. Thank you, Alainna. Next slide. An area very near and dear to me. I could talk for a long time, but I'm going to go very cursory. We have, in terms of education, race and teacher demographics, we know for the past 30, 40, 50 years, consistently, teachers in the US, public school teachers, have remained stubbornly white, middle class, and female. You can see on the chart just unbelievably how few minority teachers that we have. And there are all sorts of reasons and rationale and research to support the need for minority teachers in schools. And we can go through that in our working group. But I want to compare this, if we could go back, in comparison, go to the next slide. Thank you, Alainna. No worries there. This slide is not the percentage of teachers, it's actually the number of students that are continuing to diversify in the nation, but our teaching force is not diversifying. And so we see that as a cause of concern. Next slide, thank you. In the report, Never More Urgent, we take all the disparities across the 5 areas and more, and we show how it impacts the lived experience during a once-in-a-century pandemic. And we plan to move this research forward and looking at vaccine, not just hesitancy, but accessibility and other things. We know people, Blacks, Native Americans, Hispanics, are at the highest risk of infection and to have deadly outcomes. Black Americans account for 26% of all COVID deaths, yet they're only 12% of the population. Hispanic Americans and our Indigenous populations are 4 times to be hospitalized. Thank you, Alainna. The next couple, this one is a more drill down on that. I wanted to look up the latest statistics for you. February 16, 2021, race ethnicity was known, again highlighting the need for consistent data, was known for just over half of people who have received at least 1 dose of the vaccine. 63% were white, 9% Hispanic, 6% Black, 5% Asian. And it is noted that to date, CDC is not providing state-level demographic data for people vaccinated. Again, the call for persistent collection of data. The next couple of slides are really just for visual impact only. This is from the Kaiser Foundation. If we'll go back to that first one just very quickly. You can go on the site and you can actually click Black, Hispanic, Asian, or white, and you get a full panorama vision of the percent of vaccinations, the percent of cases, the percent of deaths, and the percent of populations. We'll just scroll through those slides in essence for time. That's
Helen?
Yes.
I'm sorry, but
Try
and wrap up quickly.
Absolutely. Very good. Thank you. Thank you for that, Carolyn. So the rest of the slides are just for visual impact only. I invite you for the breakout session at 2:30 and certainly to join our working group on equity and justice. Thank you for listening.